Hi guys! Hospitals are supposed to be safe places where healing and health are found. Patients look for the educated staff and specialized equipment for answers to their sicknesses. Unfortunately, hospitals sometimes let us down. Humans make errors. Blunders can happen in any profession. Some of the most disturbing mistakes happen when someone is unconscious in the operating room. There are many things that can go wrong in hospital. Here's a list of 10 alarming medical mistakes. Imagine waking up from surgery only to find your genitals gone owing to some medical mistakes. Harshal Rawls awoke from surgery to hear that the doctors were able to remove all the cancer from his bladder. However, the doctors also removed his penis and testicles. "I was one mad dude," Rawls said in an interview. Rawls also said that the doctors never suggested the possibility of removing his testicles and penis. The situation became worse when later it was found that cells from Rawls' penis tested negative for penile cancer. A settlement was reached in Rawls' civil suit for an undisclosed amount. A patient at a hospital in St. Louis Park, Minnesota, encountered a different but equally alarming medical error in 2008. The unnamed patient checked into the hospital to remove the cancerous kidney. A day after the surgery, doctors realized that they had removed the healthy kidney instead of the cancerous kidney. This happened when the kidney on the wrong side was labeled on patients' medical charts as cancerous. An error of this degree has, to the best of our knowledge, never happened at this hospital before, said Dr. Samuel Carlson. Operations on the wrong body part are terrible when you are the victim. When the wrong surgery is done to your child, it's a parent's nightmare. Jessie Matlock was only 4 years old when a heartbreaking hospital error occurred. He went to the hospital to correct his wandering eye. It was a standard procedure. The problem was the wrong eye was operated on. The doctor said she did not realize she had operated on the wrong eye until the surgery was completed. "It just blows me away," said Dale Matlock, Jessie's father. "I can't comprehend what happened in that operating room. This is a medical mishap that is never supposed to happen." Most patients do as they told because they believe that doctors and nurses have a competent knowledge of what they're doing. Carrie Higuera went to the emergency room in Arizona when she was pregnant because she was experiencing bleeding. Little did she know that she would become a victim of one of the most alarming medical mistakes ever. The nurse took Carrie to a CT scan room. "Is this really what I need to have done?" Carrie asked, assuming that radiation would harm the 3-month-old fetus. The nurse assured that this is what the doctor wants, so she submitted to an abdominal CT scan. Later, Higuera was visited by the emergency room physician, 2 radiologists, and someone representing the Human Resources Department. Higuera said she was informed that there was a mistake. "They said that there's another patient here named Carrie, and you two are the same age. We mixed you up. She was supposed to have the CT scan, not you." Higuera is cautious because her baby could have mental retardation, a low IQ, or growth problems because of the radiation exposure. Donald Church was not identified as the wrong patient. However, he was in tremendous pain after having a cancerous tumor removed in 2000. At first, doctors told him it was just the normal pain that patients experiencing after surgery. However, after months of continued pain, the doctors found the source of it. George had a 13-inch medical instrument inside his body that had accidentally been left there after his surgery. It's even odder because the instrument is not typically inserted completely into the body during surgery. It was removed and George has not suffered any long-term health effects from the grave mistake. He received a $97,000 settlement from the University of Washington Medical Center for the error. Some medical mistakes can have far-reaching and fatal consequences. Jessica Santillan did not have extra instruments left in her. Instead, Jessica was 17 years old when she received the heart and lungs that did not match her blood type. Santillan was a Mexican immigrant who came to the United States seeking a treatment for a life-threatening heart condition. Duke University Medical Center failed to check the compatibility of the organs before her surgery. After a second transplant operation to fix their mistake, she suffered brain damage and complications that led to her death. The surgeons gave her organs from a type A blood donor, and she had type O blood. The blunder sent her into unconsciousness. She died shortly after the attempt to switch out the organs failed. Imagine walking into a dentist office with a minor toothache and coming out missing all your teeth. Christopher Christ, a 21-year-old, was experiencing pain in his mouth, so he went to the dentist. Christ went to Amazing Family Dental in Indianapolis. He was expecting to have 3 teeth pulled from his mouth. Instead, he woke up to find that all 32 teeth had been pulled. Now he's facing life without any teeth. Sheena Cortez said that she was in another exam room and said she was in disbelief that something like this could happen. She said Christ's face looked scary. Christ said, "They pulled every last one of them," referring to his teeth. "I'm going to look like a freak now." Aaron Cook was a victim to one of the most spine-chilling medical mistakes in history. Cook had a procedure to have an ovarian tumor removed. During the procedure, she awoke to learn that she could feel everything that was happening, but was unable to communicate. This was due to an underdose of anesthesia, which causes the brain to stay awake but the muscles to stay frozen. She felt the pain of every cut during the surgery without numbness, and without any way to tell the surgeon to stop. Alicia Coleman was 19 months old when she went to a hospital. She had a seizure and went into cardiac arrest after medicine was improperly routed into her system. Coleman was born 12 months premature and had a gastrointestinal disorder, but had been improving. Alicia's mother, Dominic Coleman, said Alicia was staying in the children's home healthcare world, where a nurse mistakenly gave Alicia a drug designed to slow the absorption of food via a central line to her heart rather than through Alicia's feeding tube. This caused the seizure and cardiac arrest. Doctors tried to resuscitate Alicia for over an hour. The hospital said they believe human medical mistakes led to the accidental death of Alicia. Kane Garney, age 22, was hospitalized at St. George Hospital in London. Garney would become an unfortunate victim of a hospital neglect. He could not obtain a glass of water at the hospital. He was so desperate, he called the police from his hospital bed because he was so thirsty. Nurses and doctors continued to ignore his request for water, and he died the next day. Garney died of dehydration. Thank you for watching this video. If you enjoyed it, hit thumbs up and leave your comment. Feel free to subscribe to Real Bizarre. Thanks, and we'll see you.